Hello, everybody. My name is Mahaley, and this is describing a healthcare system in my life. Okay, so what is the sociological model? This model was developed to further the understanding of the dynamic interrelations among the various personal and environmental factors that are involved within an individual's life. So the categories in this model are individual, interpersonal, organizational, community, and public policy. The first level is the individual level. So I put books in there and the college because I value my education. Valuing my education has helped me to shape myself into being the healthcare provider that I strive to become. Without taking my schooling as serious as I do, I would not be able to be striving like I am right now. I provided my source of education at this level because I'm an individual that attends Aultman College for healthcare. I also believe in optimal health, and this is why I have the little body system right there. This belief is that if somebody is to get sick or if they're to be thrown off of their baseline, they would be able to recover and maintain their health to remain in the homeostatic level of life. And the three attributes for this level are knowledge, attitudes, and skills. Moving on to the interpersonal level, my family is my biggest support system, as you can see from my sister's wedding. So I had to include them in this level. I also included my nursing family because they have been a good strength to have along my way through this journey. Lastly, my patients, I wouldn't be able to provide my practice or evaluate myself on how I'm learning and being able to apply my skills that I have learned throughout the years without my patients. They are my influence as I am theirs for the healthcare field and for their needs. Next is the organizational level. This is the social institutions that have rules and regulations that help to affect how I and my peers provide services. This layer contains more professional peers that I can associate myself with now and in the future. I added my college as this has all of my professors and all of the nurses and doctors and other medical providers to help guide me throughout my profession. My educational source is where I learn all of my rules to perform optimal care within the healthcare system. The Ohio Board of Nursing is added because they set the rules and regulations for my profession. I also included my church because it is where I grew up and it is where I developed my belief system at. And it also helps to form new educational standards and to influence the organizational level as well. So the fourth one is community. This represents many of the relationships among organizations, institutions, and informational influencers. Comparing this level to the organizational level, many people are at the same level. This level consists of federal agencies such as the FDA, the CDC, JCO, and other organizations because it is a community ran by law. But it also helps to enforce and better the communities. They help to provide a more safe community by providing medications, safe foods. I know that they provide veterinary stuff as well, and safe medical equipment, and much more for the communities to utilize. And then the state of Ohio, highlighted there is Stark County, and I chose Stark County to additionally add to this section. Specifically, two areas. The first one is Canton, and that's because I attend Aultman College in Canton, and that's where I also perform my work in the hospital. And I also chose Massillon because this is where I originate from, and I could help to better my community in this setting. And then moving on to the last section, which is public policy. And this is influencers of local, state, national laws and policies. And this level, this is a level that they can directly and indirectly influence my license. So an example of this would be the NCLEX, which I have up there. And it is the official nursing board's exam that provides licensures for those who have passed the nursing test. This is all throughout the United States. I also included high officials like JCO, the CDC, the FDA, because they have strict instructions for optimal health. And lastly, I also included the government because they are the ones that enforce and provide the laws for us to follow for a safe community. And this is my references. Thank you. Stop recording.